morning. I am Professor Dr. Soumitra Ray. I practice as an intervention cardiologist at Advanced Medical Research Institute in Kolkata. I was given to talk today in APICON 2022 on hypertension management in atrial fibrillation. Here I bring out for you a few highlights of the present issue. As you know, atrial fibrillation is the commonest significant arrhythmia in an adult, and hypertension is perhaps the commonest medical condition in an adult. So it's no surprise that they often coexist. Particularly in elderly population, almost 10% of hypertensive patients have got atrial fibrillation and almost 90% of atrial fibrillation patients have got hypertension. Both have got common background like renin-angiotensin aldosterone system activation, sympathetic nervous system activation. The problem is that both can cause systemic thromboembolic episodes, and when they coexist, the chance of systemic thromboembolism is enhanced manifold. So we have to be very careful when we find one condition to hunt for the other condition so that we don't miss and treat it in appropriate time. Only problem sometimes we face is to record properly the blood pressure in presence of atrial fibrillation, and often the automatic machine fails to give us the accurate measure. Here I recommend to use a manual blood pressure machine to check the hypertension in an atrial fibrillation patient. Now, while treating atrial fibrillation, you must be acquainted with two very important terms called CHA2DS2 score and Hasbled score, and in both hypertension features and gives a 1 point each. But the difference is that in CHA2DS2 score, any hypertension history, even if it is controlled today with proper management, gives a point. But to be qualifying to give a point in Hasbled score, hypertension must be uncontrolled hypertension. So that is the difference between the hypertension in the two scores. Now, while we treat hypertension in atrial fibrillation, we prefer to give a RAS blockade like ARB or a beta blocker to start with, because they can control the atrial fibrillation rate and sometimes new onset atrial fibrillation in case of paroxysmal atrial fibrillation or high risk for atrial fibrillation. Of course, calcium channel blockers like verapamil and diltiazem are also suitable for both hypertension and rate control, but we have to be careful that left ventricular ejection fraction is normal. And also another important thing, while giving oral anticoagulation treatment in atrial fibrillation patient, we must ensure that the blood pressure is controlled. The best performance of blood pressure in presence of atrial fibrillation, if we can keep the systolic pressure between 120 to 130 millimeter mercury and diastolic pressure between 70 to 80 millimeter of mercury. So my friends, I think it is not very uncommon to get a patient of atrial fibrillation with hypertension in your day-to-day clinical practice. We must follow the general rule of treatment of both the atrial fibrillation of hypertension as given by different international guidelines. Just a few significant points, as I mentioned, to be kept in mind while treating hypertension in presence of atrial fibrillation. Thank you.